I'm Femi OK. Today on the stream, we're going to bring you the latest on COVID-19 in India. Of course, the story about India's second wave made headlines for many weeks. We are not leaving this story behind. So if you're on YouTube right now, you've got comments, you've got questions. We have experts in the house today. You can ask them anything, and I'm sure they will be able to respond to you. So be part of our conversation. Meanwhile, earlier this week, at the beginning of the week, Prime Minister Modi in India acknowledged that India had multiple challenges right now, tropical cyclones to deal with and also a global pandemic. Have a listen.
We are witnessing how our nation is fighting COVID-19 with full strength. It is the worst pandemic in the past 100 years, and during this pandemic, India also boldly faced several natural disasters.
So multiple challenges for India, and how is India dealing with COVID-19? Will politics get in the way? Is politics getting in the way? Let me introduce you to our guests. We have we have Dr. Sonali, and hopefully we'll be joined by Dr. Joyita as well. But first of all, Anu, welcome back to the stream. Nice to see you. Remind everybody who you are and what you do.
Hi Femi, I'm Anu. I'm a healthcare reporter in Delhi. I work at a data journalism outfit called India Spend.
Good to have you. Dr. Sonali, welcome to the stream. Tell everybody who you are and what you do.
Thank you, Femi. It is a pleasure to join you today. I'm a medical doctor by background, and I work in public health. I specifically work in the area of how do we make health systems stronger and more resilient.
Good to have you. Dr. Joyita, welcome to the stream. Introduce yourself to our international audience.
Thank you for having me on the show, Femi. I'm Dr. Joyita. I'm a physician, and I look after patients who have COVID and other diseases, but I don't treat the ICU patients. I treat the mild to moderate at-home care.
All right. Guess it's so good to have you because you all have, by virtue of being in India, you have frontline experience of this second wave of COVID. Anu, if we were looking for the current headline, what headline would you tell our audience is important to pay attention to? What's going on now?
I think the big story was, I think the last time when I was on your show, it was about oxygen and the lack of oxygen. Logistically, the government has figured that out, but right now it really is this vaccine crisis because India's vaccine crisis is a global vaccine crisis. The WHO's chief scientist has just said that there are 91 countries in Africa who are waiting for vaccines because India had committed to supply those vaccines to the WHO. So Indians are not getting the vaccines here, but the world is not getting its vaccines either. I think this is the big headline, yeah.
Thank you for sharing that with us. Dr. Sonali, looking at the numbers for the number of new infections, they appear to be going down in India right now. What are you most concerned about?
I think even though the numbers are going down, and that is good news, we have to be careful because the numbers are still much higher than the highest we saw during the first wave, which was around 90,000 at its peak, and we are still seeing about 150,000 a day. So we are still not out of the woods. We still don't know what is happening in a lot of places outside of the metros. So we really need to be on alert still.
I've got this YouTube comment coming fresh in. Hello, James. Nice to have you part of the programme today. James said, he's wondering about the amount of cases India is reporting. Is that the true amount? I bet there are many cases that are unreported and people who have died and then they're not sure that they've died of COVID because there haven't been tests. Dr. Sonali, do you want to pick up on that?
Yeah, I think, death registration is generally and reporting is generally an issue in countries like India. So from that angle, there is undercounting. There is a lack of testing facilities in rural areas. So there are stories of, 30, 40 deaths in a village, out of which maybe 1 or 2 people managed to get a test. So, of course, there is definitely undercounting. Whether it is deliberate or it is just a function of a health system that was not adequately prepared, that is debatable, but definitely there is undercounting.
Dr. Joyita, I want to get a little sense of what your COVID-19 second wave life is like in India right now. What story would you tell us to give us some insight?
So this time round, as opposed to what we had during the first wave, life was a little easier. We haven't seen these numbers ever. I have not seen these numbers in my life. I've been practicing for a long, long time. This is what we do. This is what we are supposed to be doing. This is what we've signed up for. But I don't think we ever thought that we would sign up for where we were making calls for oxygen, where we were making calls to get medicines, essential medicines at that, where we were making calls to ask for beds, begging for beds, oxygen beds, ICU beds. I mean, the medicine part of it is easy for us. We know what we do, what we have to do. We know what we write. We know what we have to prescribe. But it was heartbreaking to make calls for oxygen, make calls for beds, and then having to tell the families that, you're not on your own. I couldn't tell them that you're on your own, but I pretty much had to, say that they would have to also look around for beds and for oxygen. And it was just not me, because there were just so many patients. We were completely overwhelmed with this.
I knew you're nodding. Dr. Sonali, you're nodding. Dr. Sonali, go ahead.
Yeah, it was just, it was a nightmare, and I use an analogy for this. It was like, for a patient to get care during the crisis, during the peak, was almost like being in a storm. And the only way to get shelter is a pile of microscopic Lego bricks. And you have to piece together your shelter using those Lego bricks. And that's the only way you can be saved from the storm. So it was pretty much unlike anything any of us was ever prepared for. The entire health system sort of came apart. Every little piece had to be stitched together by the family, from getting oxygen to medicines to getting transport, whether the ambulance has oxygen, does not have oxygen. Some people there was even a case that I was familiar with where the woman spent 2 days in an ambulance because that was the only way for her to get oxygen. Hospitals were running out of oxygen. So even going to a hospital was not a guarantee that, you would get a steady supply of oxygen. So it was quite a disaster, at least here in Delhi, yeah.
So that sounds
and even in states like Uttar Pradesh,
yeah, that sounds like the worst moment, the worst time, and we saw those pictures of people almost feeling like they were gasping for air as we were covering those stories. But I knew right now the oxygen crisis appears to have passed. Can you update us?
Yeah, I just wanted to reply to that because I think, a lot of people are now referring to this in the past tense that we did do these kind of things and we did have these problems. The Prime Minister has just released a statement as part of his regular address where he's kind of bragging about this now as a success, that India solved the oxygen problem. But then the question to me really is if this was a solvable problem, if this was something that man could handle, man did not handle. There's a natural calamity that we're dealing with in terms of the pandemic, but this was a logistical issue that we should have handled. So we're able to talk about it now in past tense, but it means that there needed to have been human intervention to have not got us to that place in the first place.
Dr. Sonali, I want to...
I
please go ahead.
Agree with... Yeah, I totally agree with Anu. Much of the crisis that we saw was actually not caused by the virus. It was caused by a lack of foresight, lack of preparedness. Last year, there was a sort of hubris that was prevailing that somehow Indians are somehow naturally immune to the virus, which happened in the start, which happened after the first wave. There were even declarations that by our leaders that India has gotten through the worst of it. So there was a certain narrative which was really not scientific. And public health experts, India has excellent public health expertise. India has the resources. As we are speaking, India is spending about, I believe, $140 million on redeveloping the central historical part of Delhi. So we have sufficient resources, we have sufficient expertise, but we somehow fail to deploy it adequately to ensure adequate preparedness. We have failing to also have adequate vaccination ramp up. So there is a certain failure of leadership, and I would say it is a little bit akin to what is being witnessed in Brazil also.
Dr. Sonali, you're so nuanced that anyone outside of India may not have caught what you were saying there, and that is where the BJP decides to put their money. Their money is available for certain things and attention for certain things and not for others, like critical healthcare for Indians. I'm just making that very clear because that is what you're saying. Let me just bring in Dr. Abhishek, who is concerned about what is happening in rural areas of India. Have a listen, guys.
So the virus now has started spreading to the rural part of the country, and it's worrisome for two reasons as I see it. Number one, there's a dearth of testing facilities, and number two, there's a general hesitancy among the population of the rural India to get tested. The only solution to this problem, as I see it, is if you completely and immediately rampant up the number of testing facilities and test as many individuals as possible, isolate the cases and vaccinate the potential population. I don't think there's any other way.
A problem and a solution there from Dr. Abhishek. What do you think, Dr. Sonali?
Yes.
You start first, and then Dr. Joyita, you can go second.
Absolutely in agreement. We should all, as people of India, as the public, we should all keep an eye on the testing rates of our cities and states. And if we see them falling down, we have to raise a hue and cry. It's the only way to detect a surge early and avoid crude measures like a lockdown, which really hurt the poor. And I think I'm in total agreement with what was said.
Dr. Joyita.
I completely agree with what was said. In fact, when we were in the peak of the second wave, the testing facilities were not adequate enough. We didn't have enough tests. Many people were not getting tested. So the numbers would, whatever numbers you see, whatever numbers that they have been projected, I would say at least you would say 30% more than what was projected. We had families where the families had, all of them had symptoms, but only 1 or 2 people got tested. The others were just all assumed that they were COVID positive, and they were just given treatment accordingly because there was no testing kits available. So they have to ramp up testing. They have to get vaccination in place, and yes, they have to continue to isolate the patients properly.
Education, it is so clear, is so important, not just for India during COVID-19 second wave, but for all of us around the world. And there have been some very tricky moments for India regarding information, education and misinformation. Let us start with something that I'm going to call black fungus, Dr. Joyita, but then you're going to tell me the medical name for it and why it is becoming a bigger problem. Go ahead.
So let's give it the proper name. It's called mucormycetes, and this fungus, we are not sure. We are a little bit at crossroads about where it's coming from, because in the previous wave also we gave that many steroids, that many patients had uncontrolled sugars. So we are not sure whether it's the strain which is causing this fungus to come up. So usually what we see is there has been this time around, because the variant has been particularly virulent and has caused indiscriminate use of steroids. And we've been seeing that patients are being given high dose of steroids, and they've been given it for a longer period of time. So this has caused, and India is the diabetic capital of the world. So there are a lot of people whose sugars have gone undiagnosed, which has flared up because of the steroids that have been given. Also, COVID causes the immune system to dip, and this also allows the fungus to grow. So this is one of the reasons why this is coming up.
So Anu, for me, it seems critical that... Yeah, go ahead.
I was just doing some reporting for a story on this, and I think one of the terms that you used is very key. You were talking about misinformation, and I think India has had a problem with irrationality in medicine. Even before this pandemic, there's a tendency for doctors to some doctors to overprescribe, or patients to demand for medicines that they may not need. So this is called irrationality, and I think we've seen that happen a lot in the second wave, especially on this issue of steroids, which is directly linked, to this rise of black fungus. And a lot of it, from what I understand from the doctors who I've spoken to, they've said that, from the prescription audits that they've done, and I think Dr. Tandon, who just spoke, was also one of the doctors I had spoken to last week. He was saying that, the bulk of the prescriptions that they are seeing are people who have come to them after already having been on steroids for a very long time and been put on steroids very early on in the course of their diagnosis. So this is irrational and this is misinformation, really, because it's either patients who are pressurizing doctors to put them on some serious treatment, or doctors feeling like they need to do something and it's some sort of overcompensation that they, kind of feel like they need to adjust for. But all of this is part of misinformation and, irrationality in the space.
I'll tell you where that comes from. I'm sorry.
Yes,
I'm going to jump in over there.
Go ahead,
I'm going to jump in over there.
Yeah.
So what happens is, what do you do when there is no bed available? What do you do when there's no oxygen available? What do you do when there's no ICU bed available? What the doctor is doing is he's ramped up the steroid dose. There's WHO, CDC, all doctors, there are guidelines where they've given the recovery trial has shown us this is the exact milligram of steroid that is needed. You don't need any more, you don't need any less, and this is the duration of time that it is to be given. But when you don't have oxygen, when you don't have when you don't have beds, when you don't have ICU beds, doctors get desperate. And I myself have seen prescriptions from other doctors where they have given double the dose of steroids just to ensure that the oxygen comes up, they don't need a bed, the fever drops, the CRP levels go down. So yes, there has been indiscriminate use, and I understand why it's there, but I can't condone that.
So building upon what Dr. Joyita is saying, I think the onus of responsibility lies where the power is the greatest, right? Yeah. So who holds the power? Is it the individual doctor who's already in a situation of extreme trauma, dealing with patients in a system that's fallen apart? Or is it with our, scientific institutions and our, political leadership? Our guidelines were not updated in a timely manner, which reduces trust in what the government is putting out, both public trust and the medical community's trust. Our state guidelines, so it's not just one political party. Our state guidelines and our central guidelines, they still contain drugs like ivermectin, azithromycin, which are no longer recommended for regular patients. So,
and Dr. Sonali, you cannot just say those drugs without telling us what they do. Go ahead.
So ivermectin, I think Dr. Joyita will be better placed to do this. Ivermectin is an antiparasitic drug. So what role does it have for a virus?
Azithromycin azithromycin and doxycycline are antibiotics. They have no role to play in treating a virus unless there is a secondary infection which comes up after the 6th or 7th day. The first 5-6 days, we don't see any role of an antibiotic in treatment of the virus in the first 5 to 6 days. If the virus, the effect of the infection after 7th, 8th day, that is when the pneumonia sets in and there could be a bacterial superinfection that can happen. That is when you need an antibiotic, not before that. Certainly.
All right. I feel this is a PSA for doctors in India. I hope you're watching this because Dr. Joyita is telling you when you should be prescribing antibiotics and steroids.
If you should be prescribing it all.
All right, doctors, hold tight for a moment. Dr. Sonali, hold tight for a moment because there's some more things I want to share with you from our audience who are watching. With you, and I want to just try and squeeze them all in. So, interesting question here from Udziro. Could you discuss the misinformation spread? Yes, absolutely. That is so important. And I want to do that via Krishnesh. Krishnesh is also concerned about the misinformation. Anu, come off the back of Krishnesh's video comment. Let's play it. Go ahead.
The best thing the government can do to tackle misinformation is to guide people towards accurate sources of information and to publicly flag misinformation. However, we have seen the government use misinformation as an excuse to curb speech, which is critical of the establishment. We have also seen the government initiate prosecution against those accused of spreading misinformation.
So it's got a little dark where Anu is right now, but Anu, I'm still going to ask you for your take on this because I understand that you were told that you were not allowed to report on I'm going to use the public's term for this, black fungus, and that there's certain information that is not being shared because authorities do not want that information to be shared during a second wave of COVID-19. What's the problem with that, Anu? Go ahead. It looks like Anu has a blackout right now. Can she still hear us?
I think so. There's a little bit of a thunderstorm outside.
Yeah. All right.
So,
Dr. Sonali, you pick up, because I know you understand the issues here with the management of a narrative about COVID-19 and then getting out good information to people. It feels like there's some tension between those two missions. Go ahead, Dr. Sonali.
So, I fail to understand how science and evidence-based medicine and prescribing the correct thing according to latest medical science is a partisan issue. It should be a non-partisan issue. But however, I think governments are struggling to offer some remedy to people. So we still see certain drugs in guidelines. We still, do not see very precise, clear information coming out. For example, we knew last year how important good ventilation is, but that was not really amplified by the media or by the government. But this year there is talk of ventilation. Had we spoken about the importance of, fresh airflow, open windows, I do believe we could have reduced a certain number of cases. We only focused on distance. And I think it's really, really important not to copy-paste things from a more developed context into countries like India. So we copy-pasted social distancing, we copy-pasted the idea of lockdowns without an understanding of the socioeconomic context of developing countries. And we had a very medicalized response towards a pandemic, which is not a purely medical issue. So I think the government needs to really allow the community and the public health community, the medical community, to become a voice for science, for correct information, and not clamp down. Notices are being issued which say that nobody can speak about, say, the fungal infection we were talking about without prior permission of the government. This does not make sense at a time when the government alone cannot manage everything. It is an unprecedented situation. They need to collaborate with citizens. They need to engage people. They need to engage experts to reach to the public.
Okay.
So, very crude measures to control some sources of misinformation, are not useful.
Let me fit in one more question. This one comes from Abul Yasser, and Abul Yasser is on YouTube. And Abul is wondering if the politics from the BJP is impacting how well coronavirus is being managed in India. Oh, that's a hot seat question. I'm going to give that to Dr. Joyita. Speaking as a medical professional, how is politics either helping or hindering you, Dr. Joyita?
So I find there is a lot of mixed messaging that is happening by the government, and that hinders our treatment protocol, number one. Number two, let's start with the vaccination. Let's start with the vaccination drive. We were supposed to be the largest producer of vaccines, and we started off with the healthcare workers, then they started off with the above 60 and above 45 with the comorbidities, etc. The Prime Minister himself took the vaccine, and that I think addressed vaccine hesitancy in a huge way. He has so many followers, so he addressed the vaccine hesitancy. But then he lost the plot somewhere in between because of signing a deal with COVAX, where because of vaccine equity, he had to send vaccines all over the world. So we fell short for vaccinating our own country, our own countrymen. And that's where the second wave happened. We should have vaccinated our people quickly, faster. And we should have pre-ordered more doses. The whole world has pre-ordered doses. We didn't pre-order any vaccine doses. So that's where there's mixed messaging. Secondly, so when the government sends out kits to patients' homes who have tested positive, and the kits contain, of course, they do contain paracetamol tablets, they contain a pulse oximeter, but they also contain something known as coronil,
Thank you.
is
Dr. Joyita. She can give us a lecture on medicine and COVID-19 medicine for over an hour. Thank you so much for giving us 25 minutes of your time. We really appreciate you. Dr. Joyita Anu is back, and also Dr. Sonali, and you on YouTube. Thank you for your questions. We'll see you next time. Take care, everybody.